I'm often asked what's been my journey through GERD and surgery, and again, it's sort of ironic that my first published paper on Barrett's esophagus was in 1994, and then about 20 years later I would develop that disease and ultimately get surgery for it. So I really was one of those folks who didn't experience a significant number of heartburn symptoms. Occasionally I had heartburn, but not very often. But what I did experience was an inability to sleep flat at night. And so I would invariably go to sleep with reading a book or my iPad or something, and then slowly during the course of the night fall over and end up flat. But if I were to lie flat, I would end up regurgitating and then often choking. And it was really scaring my wife to death. It was decreasing her quality of life, not to mention mine. I need, when a surgeon has an opportunity to sleep, he or she needs to take it. And so it became a real problem, but I still ignored it all the way up until the point where I was having trouble swallowing. So once I began having trouble swallowing, I called my friendly gastroenterologist and got scoped. Unfortunately, I had really quite severe esophagitis. And he looked at me and said, "Hey, look, you need to be on PPIs." And so we did really the way things should go, which is to say I took double dose PPIs for about 3 months and then had a second endoscopy. And during that endoscopy, we found that the PPIs did not completely heal my esophagitis. And in fact, there were some areas that were suspicious for Barrett's at that time. And so, that's when I realized that I too, like many people out there, could benefit from surgery, something that was going to treat the problem a little more effectively, treat the sphincter. And so I went and had that operation done by Dr. John Lipham out at USC, and certainly I'm forever grateful to him for that. It really changed my life. We have a link to Dr. Lipham's site and some of his videos on our website, so I encourage you to go look at those. But I was back operating here in less than a week. I was out there training to be able to go out and teach other folks how to do this incredible procedure, the LINX procedure. And it's really taken my mind off of reflux on a day-to-day basis anyway, except for when I'm talking about it with patients or giving talks elsewhere. So for me, surgery was absolutely the answer. I have had a endoscopy at a year out from surgery, and my esophagitis was completely healed. So the medications couldn't heal it. My esophagitis is now completely gone. Unfortunately, it healed back as Barrett's esophagus, so I will too, like many folks out there, need to undergo constant surveillance. But that's okay. I'm happy to be able to get my quality of life back, and probably more importantly, my wife's quality of life back too. So that's been my journey.